am going to demonstrate a technique that I have used in the past to help to drain the eustachian tubes, okay? The eustachian tubes are your ear canals that can sometimes fill with fluid or get clogged, and then they can't drain. Your eustachian tubes actually drain into the back of your throat, but sometimes because of pressure or swelling or sometimes just anatomy, they can actually get kind of blocked and closed off, and then that creates pressure behind the eardrum. Pressure behind the eardrum is uncomfortable, can be painful, and it also can create infections when that fluid sits there. So this is a technique that actually can help the fascia to kind of release around that tube and sometimes pop open the tube and allow the fluid to drain, relieving pain and helping anything that is maybe stuck in there to flush out. So I'm going to demonstrate the technique. This is Nora. Hi, Nora. Okay, so you actually just you have the person that you're going to work on, or you can actually do this on yourself, but I'm going to demonstrate it on Nora. You actually lay the person and you are positioned at their head just like this, and you're going to put your thumb right into the external part of the ear here. It kind of sits really comfortably actually. You're going to use your fingers to grip onto the back of the ear, okay? And then you actually just start to very gently pull the ear away from the head. The direction of the pull is back toward the floor, toward the back of the head, and then you can actually kind of rotate from a slight diagonal pull this way and a slight diagonal pull down this way, okay? And you just keep the thumb seated really nicely in that part of the ear, okay? So actually kind of get a good grip here. And it's actually a sustained pull. So you actually just you kind of increase the tension gradually, backward, and then downward, a little bit toward the shoulder. It's not painful, but you can actually, Nora, so sorry. You actually can pull rather hard. And I would encourage you to practice it on yourself so you can see how it feels. You're going to just let the person tell you when that's enough pressure. If it's a child, just use a moderate amount of pressure and just hold it there for about anywhere from 2 to 5 minutes actually, which is a long time to hold the sustained traction here. And you can actually, you're kind of pulling down toward the back of the head, downward toward the shoulder, and then a little bit outward, kind of away from the head. And what that sustained traction allows is for the fascia, any kind of, the fascia is a connective tissue, but can get kind of bound up and tense, so you just are allowing that fascia to kind of release. When the fascia releases, it can relieve pressure and inflammation that is around the eustachian tube. So you would hold this for a few minutes. And I usually do both ears, even if it's only one ear that is sore. Usually this relieves pressure almost immediately. Okay, and then you just let go. After that, I tend to not use any oils while I'm doing that technique because it makes the ears slippery. But afterward, I might get a little bit of coconut oil. This is actually Aroma Touch, but you could use a lot of different oils. You could use lavender, you could use frankincense, basil is a great one, melaleuca. And then I'm just going to come with those oils behind the ear, in front of the ear. And you actually are going to kind of massage in small, circular motions downward along the side of the neck, kind of in a V shape there. And coming back up. You can just gently massage in small circular motions. But do the myofascial release technique first, because otherwise it'll be slippery. So that is my recommendation for how to address ear pain in yourself or in kiddos. Bye.